Hi friends, I'm Anna, and today I'd like to share with you 4 things that I learned as a pediatric critical care transport nurse. I've been fortunate enough to get to work with a lot of different patient populations in many areas of nursing practice during my time as a nurse. I've thought of a few key takeaways from my time as a pediatric critical care transport nurse that I'd like to share with you. And I know that this is a really specific title, but I think that these takeaways will be helpful for you in whatever area of nursing you work with or in any area of healthcare. So let's get started. The first thing that I learned, and learned very quickly, is that I do not know what I do not know. I had been taking care of really complicated, complex ICU status patients for several years before becoming a transport nurse, but it wasn't until I started transport that I realized just how complicated these patients are. And this makes sense. I went from a bedside nursing role where you are providing patient care to a role where I was more directing patient care and helping keep these patients stable. I didn't realize all that went into keeping these patients stable, and again, just how complex it was. And when I think about it, this makes sense. I had a very comprehensive 3-month orientation as a brand new nurse orienting to the neonatal ICU. Physicians go through medical school, residency, and then a fellowship too. So of course they would be thinking of considerations that I wouldn't even know to think about. Working one-on-one with intensivists while transporting very sick, unstable patients has given me a much deeper appreciation for their role and for the knowledge that they have. This has strengthened what I do know and has made me more aware of what I don't know. And being aware of what you don't know is the first step to knowledge expansion. The second thing I've learned as a critical care transport nurse is how to think forward and anticipate patient needs. Nothing forces you to think ahead like knowing that you won't be able to contact a physician for 30 minutes because you're in a helicopter with a patient. My lack of accessibility to the intensivist in times like this really forced me to think through everything that could possibly go wrong with my patient, what medications I would want to have handy, and what questions I needed to ask them, information I needed to clarify before we took off. Because of these experiences, I've noticed that when I am back at the bedside, I am much better able to anticipate my patient's needs a few steps down the way because I'm used to thinking in this forward-thinking manner. The third thing that I learned is how to better advocate for my patients. As I am better able to anticipate what types of problems my patient may experience, I have found that I am better able to advocate for them. I'm more assertive in my concerns, and I'm able to present a much more compelling argument to the team as to why I am concerned for this patient. When I'm out on a transport, I am typically the physician's eyes and ears, and the assessment information that I present to them, as well as the concerns that I share with them, are typically weighted very heavily in their medical treatment plan. I have learned so much through the dialogue that this approach has created, especially if I am off or incorrect in what I'm advocating for or a conclusion that I make. The providers use these opportunities to show me a more appropriate course of action, and I'm better able to apply this to future patient populations and in turn, better able to advocate for future patients. This growing and learning process in my role as a transport nurse has really strengthened my role as a patient advocate. The final thing that I learned as a children's critical care transport nurse is that I cannot be an expert in every skill all the time. This may seem like a no-brainer, but when I was a brand new transport nurse, I was terrified that some lack of skill or deficit in knowledge on my part would cause a patient harm. I thought I had to know everything, and I put so much pressure on myself to need to be an expert in pediatric emergency medicine, neonatology, pediatric cardiology, endocrinology, pediatric critical care, all while having the advanced skills that go with each of these roles. I remember feeling so overwhelmed on transport because I kept thinking, it's up to me. In the midst of these major feelings of inadequacy, a physician shared with me that I cannot be an expert in everything all the time. He reminded me that critically thinking about all of these things, utilizing the resources around me, consulting with other team members, and trying to get as many experiences and exposure to different things as possible was all that could be asked of me. This conversation brought me some much needed reassurance because, again, who can be an expert in everything all the time? I've discovered that using my skills as a nurse and understanding my limitations can actually make me a safer nurse because I am aware of those limitations that I have. I've learned that sometimes you just need to think critically. Not so you have all the right answers, but so you know the right questions. There are endless lessons that I've learned in my time as a nurse that I could share with you. But when I think back to my time as a transport nurse specifically, these are the things that still pop into my mind as big lessons that I've learned that I continue to use and think through to this day. I would love to hear what you've learned during your healthcare practice or your time as a nurse, so please put those things in the comments, like this video, and consider subscribing to not miss any more content from me in the future.